I would start by posing a question to us, or a statement more like, raising a child with special needs is a journey of love, resilience, and let's be honest, there's some tough days, and there's some happy days too. But what happens when the emotional toll starts to weigh heavy, not just on the child, but the entire family? Today, we're getting real about mental and emotional health, the struggles, the triumph, and the practical steps families can take to thrive and not just to survive. So there's a difference between surviving and thriving, and we want to make sure that the family thrives. So that's why we're here. It's going to be very practical. This panel will do justice to that, I'm sure, and we're going to give room for questions. So let's dive in. I'm going to ask a quick icebreaker, and this is posed for everybody. So you take your turn to answer it, just to loosen up. If you could give just one piece of advice to a family struggling with emotional or mental health challenges right now, what would it be?
All right, thank you so much. Yes, my piece of advice will be, you are not alone. I mean, to be sincere, right? As a professional out there who works in a clinic with different individuals, it's just to encourage and tell you that you are not alone there, right? There's what we call grit. Grit. I will just tell them, there is nobody on earth who does not need to develop that capacity, right? Irrespective of your profession, your field, you just have to be tenacious.
Tenacious.
Yes, be tenacious. You are not alone there. Everybody is going through one thing or the other, including me, your clinical psychologist. We just all have to be tenacious. All right. Thank you.
Thank you. So, grit, tenacious, you're not alone.
Yes.
Go ahead.
Hello? Okay, it works. I think you stole my
Thunder.
because that was exactly what I wanted to say. I wanted to say that I think the first thing parents must know is that there's a community of people who are there to help you. And this is very important because the first thing that parents feel is that they are the only ones experiencing that problem. And that's why their first instinct is to go inside, hide the child, do all those things because they feel that nobody understands. But know that there is a community, and I stress that is out there struggling with the same things, trying to figure out how to make this child sleep or make this child just calm down, and all you need to do is reach out, because the challenge a lot of people have is just that challenge of accepting that something is wrong and they can reach out. So all you need to do is reach out, and if you reach out to that community, they will come around you, they will hug you, they will take the child from you, they will give you the tips that you need.
Absolutely. Thank you so much for that. So, reach out to the community. You're not alone. Again, we're emphasizing that you're not alone. Bukola.
Sholakwe, one advice can never, ever be enough for a mother of a child with special needs. But since you said one advice, I will say to the person, seek help. So help is going to come in different ways. Through a counselor, through a family member that understands you, gets you. And in Nigeria, and anything I say here is not just for Nigeria alone. If you've been to other African countries, whatever happens in Nigeria is happening in Ghana, is happening all over. So we are religious beings. So whoever can listen to you, who gets you, It could be a special needs coach. Speak to someone and seek help. Thank you.
Thank you very much, Bukola. Yes, seek help. Help is very important because a lot of times you think you're alone or you think you don't need that help, and seriously, you need sometimes to bounce it off a proper counselor, a certified counselor, because a lot of times we say to ourselves, oh, I've spoken to someone, but if he's not certified, he won't give you that help that would really address the need that you're trying to address. Okay, quickly, going back to you, Mr. Osama. So we're going to try to understand the emotional and health needs of the children because, again, that's your field. So I want you to, break something down for us. But in all of it, I want you to share techniques that parents can use at home when they are in that space of emotional turmoil or, speaking to them.
For parent, right? Or for children?
Well, they always say that you can't give from an empty cup. And as a parent, if you don't have it, you can't help your child. So again, I'm saying for parents, because if we don't address the parental need, how do we start to address the child's emotional and well-being?
Okay, thank you. I want to just briefly talk about what is emotional health. What is emotional health or mental health, right? According to WHO, mental health simply means that you are able to be productive, right? You can take care of yourself and your children. You can contribute to your community. So it doesn't really mean that, emotional health is or somebody who is out there walking naked, right? If you're not able to walk functionally, you can't contribute to your environment, you can't help yourself, you can't help someone else, right? Then you may need to seek some help. Now, how do you help? As a father, as a mother, or let me say, as a family, right? We've talked about just a bit of them, but there's always something I've heard from all my parents over the years when they come to the clinic for all that. And that is the fact that some of our parents believe that they are not doing enough for the kids. So there is that sense of guilt and regret that it seems I just feel I'm not doing enough. Maybe there's something I need to do differently, right? But you've got to tell yourself, if you are here as a parent, right? You know you've taken certain steps. You've got to remind and tell yourself that, yes, I am trying. Right? You've got to remind yourself that I'm doing all I could within my capacity. There are certain things that are beyond your control. Right? That's there. You've got to remind yourself and tell yourself again and again, I am doing something. I may not be there yet, right? But I am moving. That's very important so that you don't continue to live in that sense of regret. You are doing something. You are not to live in that sense of regret or that you've not done everything possible. Yeah, the child may not be where he wants to be now, but it doesn't mean that you've not done something. That you are where you are now means that you have taken a step. So you are doing something, right? Celebrate that win. Celebrate that little effort you are putting in. Thank you.
Okay, thank you so much, Mr. Osama. Okay, so I remember that when we first came into this journey, or rather when I first started properly advocating for my child's needs, and I was in that regret state that you just said, because I said to myself, oh, I should have, I would have, maybe I should have done this, maybe, oh, why did I do this and everything. And I remember that someone, a mentor then pulled me aside and said something. She said the Igbo, there's an Igbo adage, but I don't know how to translate. I mean, she translated it in English, and she said that your morning is when you wake up. So for me, this is my own morning. Now I'm awake. What do I want to do next? And I've held on to that since then. And I have realized that it has helped me to be present in every situation. Because I tell parents, it's not enough to, you have to be present. Emotionally, physically, mentally, you have to be present. it is until you're present that you can start to give that support or that well-being that you want to translate in your family. Okay, moving on to Bukola. So, Bukola, you spoke about community of people, you spoke about seeking help. So, this question is for you: the mental load of caregiving, supporting parents and siblings within the family. You know, there's caregiver burnout is real. So, I want you to briefly touch on what the signs are, because sometimes we as parents don't even realize that we're burning out until it's too late. And how can we prioritize, how can we as caregivers, parents, prioritize mental health without feeling guilty?
Okay, so
Yeah.
let me just start by giving a brief introduction about who I am so that you know where I'm coming from.
Yeah.
So, my daughter, Oluwalonimi, she has cerebral palsy, and she's a level 5. So if 1 is least affected, 5 is most affected, she's a 5. And about 12 years ago, when I got that diagnosis, of course, I was devastated. I mean, my husband and I, we were devastated. And since then, it's been a journey of healing, learning, processing. And like Sholakpe said, in my own case, what really helped me, because I want to start from there from some parents that are here, because I've had questions of how do I get from the denial stage, the grieving stage. So first for me was denial. And I was, based on my own story, which our stories will be unique, right? I was more of enemy focused. Hey, my enemies have done this one, oh. And I was just jumping from one church to another church, looking for solution. And I kept asking questions, the usual questions, why me? I'm a believer. I pay my tithes, I'm a worker in church. What sin have I committed, for me to be here? So, from that stage, for my own personal experience, it was a near accident that shook me, reset my brain, and I sat down and began to ask pertinent questions. What am I looking for? Because what I was looking for was a cure. But as a person of faith, so pardon me, I'm a person of faith, I handed over my daughter to God, and I said, I'm going to be calm. I'm going to be still. And I'm going to hand her over to you. I'm not going to jump anywhere. So with that, I settled down, and started the healing process. Because while you're trying to get a cure, you don't even know your child. You don't even know what the child is, what the child is not, right? So that process got me on my healing journey. And what has helped me, back to the question, as a caregiver, is understanding that I can't do this alone. Right? So, for me, I would say I'm blessed with a supporting spouse, because that is your number one support system. I had to build a support system. That's what has worked for me. Some mothers will say, I can't trust a caregiver with my child. Honestly, when you have a child that has cerebral palsy and the 4 limbs are affected, you can't keep doing this all the time. So let's go back to trauma. When you say, you're experiencing trauma and all that, trauma, would show in the emotional and the mental state, but it is also going to show in your physical body. When a woman is having pains, and my neck is paining me, my back is aching me, I'm not sleeping well, those are signs of stress. Those are signs of trauma. So I always tell special needs moms, that what are the things you can do? At that initial stage, affirmations will not help you. Because you are not even grounded enough to start saying, I'm blessed, my child is blessed. Things that have helped me, things I have done, core exercise, as in exercise that you'll be sweating. Things like boxing, things like running, things that you can sweat. That's one. Then because I'm a writer, I journal. Now, if you don't have that gift of writing out to express what is in your mind as it is, then you can speak those things out. You can speak to a therapist, a special needs coach, but it has to be someone that understands your journey, what you're going through. You will get a community, and it's not just any kind of community. Not communities that you go and traumatize yourself all over again. It has to be a community that would help your healing process. Shall I put? Do I still have time?
No, you don't.
All right, let me stop here.
Thank you so much, Bukola. So quickly, Yinka, they didn't get the chance to tell us how you are, interwoven with the special needs community. That's one. So I would like you to shortly, quickly touch on that. Wait, hold on. And then I also know that you're on the board of a lot of non-profits. I want you to answer this question. It's about advocacy and breaking the stigma around, again, we're still talking about mental health and emotional well-being. So talk about it based on your experience with the non-profits you've worked on and based on your personal work. Make it practical, make it accessible, make it short and quick.
Okay. Thank you. So, what's my story? I'm a parent. I'm a parent of a special needs child. And we found this out about 15 years ago. Our son, our only son, started to demonstrate this behaviors that we couldn't understand. Very hyperactive, self-harming, and it wasn't verbal. So the first reaction was, like she said, to deny and say, okay, it doesn't exist and all that, and believe that somehow there was some miraculous cure to what was going on. But along the line, we came to that point of realizing that something was wrong, and I think that that's where every parent gets to, when you just get to that point to know something is wrong, and you permit yourself to do something about it. And we permitted ourselves to say, okay, we're going to do something about it. And we started that journey in 2000, and this was 2010, I believe. We started that journey, and we came across a Dr. Dotun Akonde at that time, who understood what we were going through. And like she said, we were people of faith. And so we needed someone who understood that this was not just a mental health issue for us, it was also a faith issue. And she understood that, and she helped us through that process. In 2017, I then came out publicly. So that was the first time I came out publicly and I spoke about my child's autism. And a lot of people were shocked because they felt that they didn't know that we were going through that at that time. And in doing that, it kind of it caught the media, and then a lot of media organizations came to ask questions because I was talking about him and how much that he had progressed. Now, it is my experience in handling that aspect of it that made me go into the advocacy of it, and that's where I will connect it. Now, we started my son's name is Daniel. We started his therapy sometime in 2010. He didn't have any speech. He had this, so we were doing ABA. I'm sure you understand the terms. I don't have to explain that. We started ABA, and then we started his speech therapy. And as at that time, it was costing us something in the neighborhood, in a year, it was costing us somewhere in the neighborhood of about ₦1 million. And we had to we had to dedicate a car, a driver to the child. It was nearly going to bankrupt us. Now, I could afford it, but then it nearly bankrupted me. But I could afford it. And we gave our child the best, care that we can, and the child is good for it. So I started asking myself the question, what of those who can't afford it? What of those who can afford to pay the cost of those therapists, and they don't come cheap? What do we do about trying to help parents who can't understand what they need to do, and then eventually, when they understand, they are told that, sorry, you can't afford it, and so you just have to take your child away, and whatever happens to him, happens to him. What happens is that those parents take their children to spiritual homes and they do more harm. So I started to advocate, and I said that, look, there are some things that we need to do, and this will bring me to talk about not just the government. And the government is the easy one for everybody to talk about. Oh, government needs to do this, government needs to do that. And I agree that government needs to have inclusive schools. Government needs to have in schools, make sure that they have teachers who understand how to handle special needs children. But I am particular about the private sector, because the private sector has a lot more opportunity to do this. That the way they can help is to support a lot of training around the whole special needs and specialist and therapist. Because if they're able to sponsor or grant scholarships for this training or this capacity, it makes for the intervention of these specialists when they are working on other children, it makes them cheaper. So that they don't have to charge people at very, it's expensive right now to get those skills. Yeah. And so if it costs me a lot of money to get the skills, and you're asking me to do it for free, it doesn't make sense. It's like asking a doctor, having gone to 7 years. Is it 7 years? Or more, and it costs you a lot to be a doctor, and somebody says, come and do it pro bono. No. So, but if you are able to subsidize that cost in a way that makes it cheaper for people to go and do that course, go and do the trainings, get the certifications, they are able to then offer those services at cheaper rates to parents who can't afford it. And then also, corporate entities being able to provide scholarships and training centers. So those were that's what I've been working on, over the last few years. And I appeal, especially to corporate entities to support this.
Thank you so much. Thank you very much. So I'm going to open up the floor, and we're going to take a couple of questions.
And in my practice, I've come across a lot of children unknowingly. I remember the first time I had an encounter with an autistic child. I didn't know. No, as a class teacher, as a Montessori trained class teacher, I was in the class, and at the end of the section, I was giving my report. There was a particular boy that caught my attention, and I gave a report concerning him. His name was Ebuka, and when I submitted that report, it caught the attention of the owner of the school. So she called me and this particular report you have given about this child, because I realized that child was always isolated. He wouldn't mix with other kids. He was always on the screen. What I saw was what I wrote down. So I never knew that these are symptoms of an autistic child. So we called they called the parents. That was far back, over 15 years back now. So they called the parents, and immediately they called the parent. The woman was panicking. What is it? She came to me what did you see? What happened? I said, I don't know. Meet the owner of the school. So when she met the owner of the school, she narrated her ordeal. Apparently, she had had several cases of children like that. And
your question?
Yes, my question now is this: the inclusion of those kids. Because working in different schools, I realized that some schools don't really want to absorb this kind of children in their midst. Probably because, one, they feel they don't have enough knowledge. One, then two, they feel they don't have the instruments. So how do we pass this across to schools? There are a lot of schools in Lagos State all over. And within these schools, we have a lot of children with disabilities. And most cases, their class teachers just see these children on a daily basis, flog hell out of them, not knowing that these are disabilities that could be attended to. So there is a whole lot of, how do we go further in the advocacy of inclusion in so many schools around us? This is my question.
Thank you. So I will let Bukola answer the question, but I would also try to tell you one thing that you said towards the end: advocacy. It starts with you and I.
Good morning, Hall. My name is Shola Oye Kunle. I am an hearing impaired. I am working with Lagos State government at Ikorodu Primary School, inclusive. We have many special need children in our school. I know how to teach many special needs students with different methodology. Even how to teach them how to read, because I have talked before I became deaf. I can hear before. My child is also a special need person. I have deaf son that is in my school too. The problem we have in our school is to teach them, we don't have more instructional materials. Many materials we need to make things easier for the special needs students. We don't have more teachers. We will be happy if you can help us with volunteer special teacher and that can work with us. Or if NGO can help us with resources and special teachers so that the students will not just be there and will be overburdened.
Thank you very much. Okay, take all the advocacy questions and then the funding questions to you.
Okay, thank you very much.
We have less than 1 minute
So
now.
for the woman, I'm a mother of a child with special needs, and through my drive and asking questions, I started advocating, right? You are a teacher. Don't wait for the government. Don't wait for anybody. Where you are, you can advocate. And people are doing different things. So all you have to do is to connect. Like Toby Lover is into teaching teachers, mainstreaming children with cerebral palsy. Sholakpa is doing one. I'm also doing different. So there are different people doing advocacy. Connect, send an email. What we can do, we can partner and do things to advocate in inclusive education, speaking to teachers. Secondly, the man said, oh, I can't go to church, I can't afford special needs school. Like he has said, Lagos State, they have more than, in all the local governments in Lagos, they have 36 inclusive units. They are not properly inclusive education, but they have classrooms within the mainstream schools for persons with disabilities. So please look into that. Then join a special needs community. Thank you.
All right. Do you want?
Go ahead.
Okay. So let me speak quickly to the funding thing. Now, there are no easy solutions, and I will be the last person that will come here to tell you that there's some way to do it. But you see, this conference is part of that solution, because this conference is bringing people together to talk about this. I'll ask you a question. 2 decades ago, HIV/AIDS, or 3 decades ago, HIV/AIDS was a big deal, right? It's no longer. Nobody talks about it. You know why? Because the world came together, saw it as a problem, put funding into it, and eradicated it. The reality today is that we have not advocated enough how big this issue is. And that lady and that gentleman who talked about the fact that we have a lot of special needs children in school, discovered not by the parents, but by teachers. You understand? So we need to make a lot of noise. We need to advocate. The community needs to join us together. It needs to get voices, influences in the political space, in the private space, come back together and say, this is a big issue. We need funding. And we can get funding from international agents, from local agents, from private sector people, and make sure that these children get the kind of resources they need, funded by big players. Bill Gates is putting money into malaria. It's solving a lot of problems. There's no reason why we cannot galvanize support all over the world to fund this, because it's a big problem.
Yeah, thank you very much.
All right, let me quickly talk about the psychiatric case. I am in the field, but I can tell you that the first step is non-psychiatric, to be sincere. And then if you are a parent here, and the first thing you want to think about is taking them to psychiatry, I can tell you it's more than that. Psychiatry comes after you've tried behavioral therapy, you've tried every other approach. Then you can think about psychiatry to address what we call comorbid conditions, which means conditions that come alongside with the autism or the ADHD, like anxiety, depression, psychosis. That's what the psychiatry is meant for. But taking the autistic child to psychiatry centers, they are going to do something. The child will turn into an entirely different thing. I have been there and I know all this, right? The first thing is just go through the proper professionals, the ABA, the occupational therapy, the pediatricians, that will advise better, not the psychiatry. Thank you.
Thank you very much. And our time is up. Just to quickly follow up on what you were saying, I know my organization is doing something with grassroots advocacy. We're going into local government communities and talking directly with the people that are in the grassroots. I want you to remember that the topic was emotional and well-being of the entire family, and I want you to remember to continue to fill your tank. You can't give what you don't have. Thank you, everyone.